Ministers. Deputy Catherine Connolly.
And I welcome the opportunity to participate in this. And once again, I just wanted to put it in perspective. 52% of the deaths, 4,628, 52% of those have been notified since the 1st of January this year. Of the 2,300 and 232,164 confirmed cases, 60% of these have been notified since the 1st of January this year. So more people have died and more cases in this phase, all eminently foreseeable. So I won't use up my time. I said it last week, but it's important to put it in perspective. And you've given a speech here today, and Minister, I welcome you. And I think you're taking the right approach in standing here and doing your best to answer questions. However, am I happy with those answers? I certainly am not, because the whole thing is phrased in terms of a vaccine rollout, which I understand that's the title of the thing today. But generally in relation to the government, vaccination is one part of an effective overall plan to deal with COVID. And I noticed that we're just talking about vaccination now, and not just today, because that's your role today, but generally from the government, all our eggs in one basket, which is totally unacceptable. So I'm going to make a few general points in a minute, but just to take issue with one or two things in your speech. When you start quoting GPs, there's an onus on you to get a broad variety of GPs, and I welcome the GPs who think it's a collective mission and history has been made and it's D-Day and it's all marvellous. You know, but I can quote other GPs, which a lot of TDs have done here today, from Connemara. Today I'm being told, for example, that it's totally inconsistent, the rollout in relation to it in Connemara. So we have a doctor here, most unusual for doctors to contact me, let me tell you. So they're going out on the limb when they do that. And despite the Minister's assurances and his undoubted confidence in the information he's receiving, the fact remains that there are huge gaps in the amounts of vaccines rolled out. And then one practice with 500 patients over 70 and only getting a small amount of vaccines, and other practices with less in that age group getting more. And of course, in the middle of February, we had 4 GPs, 3 of them getting a rollout, 1 of them getting nothing. He since went on the radio, was very vocal about it, and has it got any amount of vaccine since, as I understand it, Pfizer? And he's saying this himself, and he's moved on out to the 70-year-olds. So huge inconsistencies on the ground. I'm not sure that we could expect any better, because the health executive was at creaking point before the pandemic and the public health system was in a mess. So I would love a debate someday here in this stall in relation to all the important aspects of dealing with a pandemic. Last week I quoted Mr. Ryan, who said we still had time to change. That was March last year, reluctantly declaring a pandemic and saying there are different aspects to this that we need to deal with: testing, tracing, isolating and treatment. To my absolute horror last week, I heard a doctor from UCG in Galway, a very nice doctor, talking about students who had got the COVID again. And the whole conversation was about getting COVID a second time, as opposed to testing, tracing and telling us how these students got it in the first place. Not a single question put to this doctor on national airwaves, and no attempt by the doctor to explain the lack of testing, of tracing. If we look at, I'm not sure if the Minister would have a chance to answer, but she told us that all over 85-year-olds would be vaccinated. Maybe you'd be able to come back to me with a note. Is that the first dose or the second dose? And where does that relate to housebound? Again, somebody at their wits' end. She said, I'm actually throwing things at the radio and the television when we are assured that everything is going well. My 90-year-old mother is housebound, has not received any vaccination because the ambulance programme that you told was going to be rolled out has not been rolled out yet. Then you told me last week, Minister, that you'd get back to me about the call centre. No one has gone back to me about a call centre, the cost of it, how it works, and these people contacting us are at the wit's end. In the last 40 seconds, I started by saying I frustration in relation to constant chat about vaccination without any time being allocated to all the other aspects of it. I'm also tired of hearing TDs calling on the Minister, Taoiseach, to talk to AstraZeneca. They have utterly failed in their contractual duties. I have no idea what a mess, how it was made of that contract. But now we're going to appeal, as it were, to the bully who's stockpiling, as opposed to looking outside of the box and how do we get vaccination on a non-profit basis in the future, because we'll face future variants, future epidemics. What about looking at Cuba? 9 million people. They seem to have a very low death rate. Have we talked to them? I understand they're developing 5 vaccinations, one to be rolled out in July, on a non-profit basis. Are there other examples we can look at? Irma.
Thanks, Deputy Connolly. Minister. Ministers.
Gaurav Mahagud Kahirlak. As we wrap up here this evening, or this morning, I'm just going to speak about 2 different things, and one of them is in relation to the housebound individuals that Deputy Connolly has just raised. And I just want to give, I suppose, an update in relation to how it is actually working. So GP practices receive guidance from the HSE home vaccination programme for the over 70s who are housebound. So they had the responsibility of referring eligible patients who required this service. We assumed that there would be approximately 1,500 people in this group, but there are actually 2,000 people aged over 70 years and older that have been referred for home vaccination. The housebound vaccination programme started on the 12th of March, and by the end of this week, so this is the 2nd week of it, 740 people will be vaccinated. So dose 1 of the vaccination programme has been completed in Dublin City and County, in the North East and the Midlands. So vaccination has commenced in the South East for this week. So by the end of this week, we will have 740 people. In the next 2 weeks then, the programme will expand to the west and to the south of the country. All first doses are expected to be administered across the country in early April. And can I just say how it was determined? So it is a huge logistical challenge, and the decision was made that the National Ambulance Service would roll out these vaccines. So there are dedicated regional teams in each area that are rolling out the vaccine. And I want to thank the National Ambulance Service, because this is obviously a slower process than when somebody attends a clinic or a mass vaccination centre. It is much slower because these people are very vulnerable and they are housebound. But can I just say, and I have said it so many times, nobody will be left behind, and we are getting through the first doses. So just to reiterate, 740 by the end of this week of the 2,000. And Kahirlak, I just want to move on then just to talk a little bit about nursing homes, if that's okay. The prioritisation of those in nursing homes and long-term residential care facilities has proven to be the right approach, as those most at risk to a bad outcome of serious illness or death from COVID. And I know there has been several calls here today in relation to how prioritisation is determined, but I fervently believe, and I know all my colleagues do, that prioritisation for those most at risk of COVID has to be based on clear medical and clinician guidelines, and it can never be determined by politicians. So as a result of a very successful rollout of the vaccine in nursing homes, 99% of residents and over 90% of staff have been vaccinated. So as a result, visitation resumed on Monday of this week, the 22nd, in relation to those living in nursing homes, which was really, really welcome. So residents may be facilitated to receive 2 visits per week on general compassionate grounds. So that means that they are entitled to have a visit. And this is possible following 2 weeks after full vaccination. So that's the norm in nursing homes. There is no requirement to limit visits to less than 1 hour, and I want to state that categorically. And this is an increase from the current guidelines, where 1 visit per resident is facilitated every 2 weeks previously. Also, the same family members do not have to be those listed to visit. So say, for example, there's a family with their mum or dad in a nursing home, and there could be 6 siblings. It doesn't mean that the same 2 people have to visit every week. They can rotate. I am aware of some nursing homes who are taking a cautious approach, and they are saying that it has to be the same 2 dedicated family members, but that is not the case. And there is no obligation that the same 2 family members have to visit weekly. I am asking all nursing homes to support and implement these new visitation guidelines. These guidelines are in line with existing public health guidance and advice, and vigilance on the general infection prevention measures must be maintained. Now, the guidance will be kept under continuing review as new evidence and data emerges. And just another clarification is, we have taken a cautious approach in relation to nursing homes. The pandemic bore down really, really hard, and 88% of those we have lost have been aged over 70, and over half of those we have lost have died in the nursing home sector. So I just want to say that we still have to take a cautious approach. So today we still have 68 open outbreaks of COVID in the nursing homes, but they are not of the scale, or they are not of the amount of people that we would have previously, and a lot of these cases are now asymptomatic. But just, I suppose, on a good note, just to show how the vaccine programme in nursing homes and in long-term residential care facilities has been so successful. Last week, this was round 9 of serial testing. Of the 40,423 people that were tested, we only had 81 cases detected of COVID, 0.20%. So that is really a positive news for those that have worked so hard in that sector for the last 12 months. And I just want to compliment everyone who has worked in that sector. There has been very, very difficult, traumatic days. There has been lonely days, and it has been really, really tough on residents, on families, and on those working there. But I do think when we see how successful the vaccine programme has been in nursing homes, it just shows that there is light at the end of the tunnel. Garv Mahagud.
Thanks, Minister Butler. Minister Donnelly.
Magath, Cahirlock. I might start, if I may, in fact, use the time to address the various issues that Deputy Connolly has raised.
Had a couple of issues that he gave you ample time to report on, but you ran out of time. Just if you could refer to them.
I might revert in writing. Is the deputy here?
He is, yeah.
Oh, I'll apologies, Chair.
Lockdown issue and the review, it was raised by Deputy Owen Murphy. There wasn't a reply to it. I've raised it as well, and I think it would be important that there would be clarification.
Thanks, Deputy. It's certainly something, it was part of the original plan, but I'd prefer not to speculate on issues like that when there is a lot of thinking going on at the moment in terms of what happens after the 5th of April, but I take the Deputy's points very, very much on board. To the points around the GP distribution, I hope Deputy Connolly won't mind me quoting to GPs who were saying positive things. There has been a lot of coverage of the GPs where they didn't get the vaccines when they should have, and they should have. Sometimes that was unavoidable because supply from the pharmaceutical companies didn't come in, but sometimes, particularly in the initial few weeks, it wasn't flawless. And there were improvements that were needed, and a lot of things have been put in place. And can I say the Deputy should have had from me, and I'd like to apologise if I committed last week, or it would have been 2 weeks ago, I think, at this stage, to answers on the call centre. I did commit to them, and the Deputy should have had them, and we will chase them up. The GP model is working well. It's not flawless, but we are hearing very, very positive things in terms of the call centre that's been put in place, the improvements to the supply. There's now a week of notice to the GPs. There will always continue to be wrinkles for individual GPs as supply goes up and down, and we manage what is a very complex logistical operation. But we must always endeavour to get it as right as is possible and continue to learn. With regard to those 85 and over, I can confirm to the Deputy that that cohort has now been very largely vaccinated. So within the 3-week period that we set, approximately 99% of that cohort was vaccinated via the GPs. And as Deputy Butler has said, the National Ambulance Service this week is now engaged in a national programme of going and vaccinating those who are housebound. And then finally, I think Deputy Connolly quite rightly has called for a wider debate. We do debate vaccines here regularly, and for understandable reason, because it is such an important part of our response to COVID. So in the minute or so that I have left, can I just say that within healthcare there are essentially 3 things that we are focusing on right now. The context is huge progress has been made. We've gone down now to one of the lowest COVID rates in Europe, but we have to protect that progress. And as we know, cases have stalled. So the answer is, what are we doing? And really, in health, we have 3 big areas of focus. The first is on targeting suppression of the virus in Ireland. So today, for example, we've opened 5 walk-in PCR testing centres. We're engaging locally with local communities. There is engagement with unions and with the employment sector to look at work commutes, to look at health and safety within the workplace, to target cases that are associated with commutes to work. The second thing we're doing is we're further strengthening our biosecurity at our borders to protect against variants, and the latest measure this week is the launch of hotel quarantining. And then obviously the third thing, which has been the focus of today's debate, is we're vaccinating as quickly as possible. We are fighting for every single vaccine we can get, and then we are ensuring that those vaccines are administered as quickly as they come into the country. Thank you, Connolly.
Thanks, Minister. Thanks, Ministers of State.